I attended Yeshiva University in New York, which is a wonderful institution in which we learn and study Torah subjects half the day, approximately, or a little more than half the day. And the other half the day, or a little more than half the day, we studied regular university subjects. I majored actually in history and philosophy, but I took the necessary required courses and was, thank God, able to get a place in an excellent medical school, which was the Albert Einstein College of Medicine. I then did my internship in internal medicine, therapist, and after we finished that, I specialized in ophthalmology, doing a residency at the Downstate Medical Center, and then a fellowship in ophthalmic plastic and reconstructive surgery at the Harvard Medical School, the Massachusetts Eye and Ear Infirmary.
Unbelievable. So in other words, from Albert Einstein Medical School, you went to Harvard
Yes.
Medical School as a surgeon.
Yes.
Wow. First of all, why did you want to be a doctor? And if a doctor specifically, eye doctor?
To be a doctor is a calling. It's not just something you do. It's too hard, too difficult, too demanding, and frankly, otherwise not rewarding enough just to do it as a job. You have to be drawn to it with your heart and soul, because that's what it takes. And one of the things that I'm most grateful for in life, aside from all the other blessings that God has bestowed upon me, is that I'm able to do my working life as a doctor and work day and night to try to accomplish good in life and good in this world.
Meaning treating patients and healing
Treating
them.
patients.
That's the calling.
Treating patients.
Did you have anyone in your family, friends that you followed in that regard, or you were first?
I have an older brother who is a psychiatrist, actually. He's very smart and one of the best human beings I know. And I have been inspired by him in my life in many ways, and I am proud to call him brother.
And why eye doctor? Why ophthalmologist?
It appealed to me. It's very elegant. It's certainly an important area of medical endeavor. It's not all men and not all women, but it's both. It's not all old and all young, but it's both. It's medical and it's surgical, and it is elegant. And the results are so gratifying when people who cannot see then see.
Can open their eyes and see.
Yes.
And actually, the vast majority of information that we get in the world is through our eyes. So we can appreciate the eyes, unfortunately, only when we lose the sight.
May God protect us.
Amen.
And as you know, Rabbi, the Talmud says a person who is blind is as if dead.
Correct. It's a different world. So, and then maybe a few words about the other part of the day, because you told me that you were studying in Yeshiva University and basically involving yourself, learning, spiritual Jewish tradition, Torah. And I know you as an amazing author of great Torah articles. How it happened that not only you became a student, but really a great teacher?
I've been teaching actually my entire career, teaching in medicine, teaching residents, teaching young doctors, teaching them, training them in being ophthalmologists. With regard to the other pursuits, that is in the religious or the Torah sphere of life, that is the lifelong vocation and avocation of the Jew. You never stop studying and learning.
I have to express my thanks and appreciation of your tremendous art of words. Not only, visual arts are the area of ophthalmologist, but reading your articles really inspire me because every word is a music.
Thank you.
You appreciate your music of the language, and you very elegantly using words. Sometimes it's one word sentence. Very powerful.
Thank you. I have to say that, yes, it does require a great deal of thought in thinking what to say and what message to deliver. But I can't take all the credit because, frankly, Sometimes I just sit down at the keypad and it just comes out.
Inspiration.
It just comes out.
Now, with your permission, I wanted to ask you a few questions that I think most of our readers or viewers would be interested. And please add some other questions that you think that your patients frequently ask you. First of all, I remember when I was getting glasses for the near sight problems of vision, there were different opinions to use glasses, not use. Some people said when you begin using glasses, you just allow your vision to deteriorate. So try as long as you possibly can not to use glasses at all. Is it something that makes sense today, or the opposite? You need to, doctor prescribed you glasses, and that's what you need to do, and there's no consequences or negative consequences on your vision.
It's an interesting thing that one of the most common manifestations of medical or even optometric interaction with patients has to do with glasses and seeing and development. And the answer is, as I see it, to your question, is despite all our experience with it, we don't really know for sure. There are people, especially children during the developmental years, who continue to get more and more nearsighted. Some of it is genetic. Some of it seems to be individual. How much is related to how well they use their eyes, or how much they use their eyes, or how intensely they use their eyes. For some individuals, it seems to play a role, and for other individuals, it seems not to play a role.
Amazing.
So there's a lot yet to learn and understand in how this works.
Wonderful. Another question, even when the glasses are prescribed, some people, involved in sports, or maybe ladies who are not interested in putting glasses on themselves, turn to lenses. Well, they require, careful use of lenses and, some, kind of effort. Glasses versus lenses. There any advice from your side?
I think contact lenses are wonderful as long as the patient possesses the maturity and the responsibility to care for it in the proper way, proper hygiene and cleanliness, not to use the lenses when the eye is inflamed, and I've seen people who do that. I also insist that all my patients who wear contact lenses, even who wear contact lenses every day, that they must possess a pair of glasses. Otherwise, if their eye is red and inflamed and they're stuck, many of them are tempted to wear the lenses anyway, and they get into trouble.
Thank you. Now, another question I believe that many people ask, glasses are very expensive, and especially when the, problems of vision continue to deteriorate, people say, so why do I need that? Let me go just have a surgery. It's going to be less expensive than buying new glasses every year. Well, but the surgery is traumatic and maybe risky. So corrective surgery versus lenses.
Well, there certainly is a risk to it. The risk, statistically speaking, is not great, but like any other elective surgical endeavor, the risk goes way down if the patients are very carefully selected by a very careful and discriminating doctor. And that's really, really important, to have the right doctor, the doctor who's looking out for the patient rather than
because it's an expensive procedure.
Well, what's the price tag on one's vision and one's visual well-being? My usual philosophy with regard to laser vision correction is that if the patient doesn't want to wear glasses but is content to wear contact lenses and is a successful and happy contact lens wearer, continue to wear the contacts. Why do anything invasive to the eye? But there are lots of people who find glasses inconvenient, they don't do well with their contacts, and it's difficult and they're stuck. And those patients, if they fall into the proper parameters, do great with laser vision correction. 2 of my children have had it, and thank God they've done very, very well.
What are the proper parameters?
The right number, the right measurement, the right thickness of the cornea.
Age?
Age, yes and no. Technically, not so much, but in fact, much older patients or significantly older patients, when they're in the age when they may develop cataracts or are starting to develop cataracts? Certainly not, because the cataract surgery alone will accomplish the same thing. Patients who are too young while the eyes are still changing? Of course not. You can't hit a moving target. The child who is -4 today might be -6 tomorrow. Having LASIK now will not stop the process. So you have to wait until the eyes have stabilized. And we see different populations that stabilize at different stages. Studious populations, for example. Take a typical New York population or a typical New York Jewish population, for example, often get more nearsighted a little longer in life, a little longer during the years of their development than some others because they use their eyes so intensively. So we want to make sure that the eyes have not changed for a while before we do LASIK.
Thank you. What about how often a person really should see an eye doctor, like once annual checkup, even when person is aging from the age 50 or more?
That's a great question. That's a great question. Obviously, it depends who. What's the family history? Is there glaucoma in the family? Is there macular degeneration in the family? Is there any other eye disease in the family? What's the state of the patient's health? Is he diabetic? Does he have high blood pressure? Are there things going on in his general health that can be reflected in the eye? And in fact, there is barely a medical condition of the human body that does not have some eye manifestation. And very often the first diagnosis of diabetes is made in the ophthalmologist's office, for example, or high blood pressure, or high cholesterol, or kidney disease, or a variety of many, many other problems, neurological problems.
Amazing. In other words, the eyes are not only like a window into the brain, but actually in a way window into human body in general.
Absolutely.
Really fascinating.
It's the one part of the body that the doctor could look into without having to stick a tube in of some kind.
Wow. Interesting. It's a really lesson in integrative approach to medicine, where one area of medicine can actually enrich the others. And what are the questions that usually interest your patients that they want to ask you, and now you have an opportunity maybe to answer a few of them, so to speak, once and for all?
Okay. So first of all, just to finish up on something, the subject you raised, it's not just sick people or old people who need to have their eyes checked. Everybody should. Not necessarily with great frequency, depends on the age. Younger people less often. Anybody who's rather nearsighted must have a regular exam because there are problems that can occur in the retina in the back of the eye. The other, well, look, in medicine, as in most things, that which occurs most commonly is that which brings most patients in. So some of the more well-known to patients diagnostic entities, cataract, glaucoma, macular degeneration, these are the bread and butter of an ophthalmologic practice. Of course, there's always episodic things like conjunctivitis and blepharitis, but these things are not the major challenging issues that the health-related issues that I spoke about. So people want to know. They come to the office and say they were told they have cataracts. What should they do about it? Should they do something? Should they do nothing? They don't. The patient with glaucoma often doesn't know that he has glaucoma because it's painless, and therefore the patient has his vision stolen from him bit by bit, and he can't even tell until it's too late. Macular degeneration can sneak up on a patient and then suddenly cause trouble. Arteriosclerosis, hardening of the arteries, can cause occlusion of the blood vessels in the back of the eye. But when the doctor looks into the eye, he can see things that may suggest that a process like this is going on, and perhaps intervention can be done early enough. But when we look in the eye, we also have the ability to put together what we see in the eye together with what we know about the patient's general health, and we have ways of looking at the circulation in the brain as well, also non-invasive with ultrasound techniques that tell us, is the blood circulation in the brain, is it circulating properly? These are critically important questions. With regard to your specific question, the common diagnoses, people ask, what should they do about the cataract? First of all, I explain to them what a cataract is. It's not a skin on the front of the eye, as patients often think. It is actually the lens of the eye, which is no longer quite clear. Would you like me to use Russian terminology or English terminology?
Whatever you want, whatever you prefer. Feel free.
Inside the eye, there's a lens, and this lens focuses the light. The light enters the eye and is focused by the cornea, which is the clear window of the eye. In Russian, it's called ragavitsa. The ragavitsa is the main focusing surface of the eye. It's curved. Your living room window does not curve or focus light. It lets the light transmit through unchanged. It is a curved surface that does focusing. The next focusing surface is the lens. All this focusing is to bring a focused, clear image onto the glaznoid nova, sichatka in the back of the eye, which receives, listen to what happens, it receives this focused light. An incredible series of photochemical and electrical reactions occur, one after the other, which somehow, miraculously, transforms a picture into a little spark of electricity. That spark of electricity travels through the brain, not to the front, but all the way to the back. Along the way, it gets oriented spatially, so that this little spark reaches what's called the cerebral cortex in the back of the brain. The cortex in the brain receives this little spark and interprets it as vision. Chuda. Masa Bereshis. Chuda. Now, I'm going to add a personal note here. There are people who, because they don't want to have to answer to God, will take this incredibly miraculous system and twist logic every which way backwards to somehow explain that it happened by accident, but they can't. Anyway.
I want to interject one little thing. Many years, not many ago, a few years ago, I was in Chicago. And it was a seminar, and someone came to me with his son, a religious person with a religious son, Balchova. And he said, Rabbi, can you help me? I said, what, you know, of course. He said, I want to speak to you privately. And he said, you know, my son became religious. And I was happy because he was in a different world, which wasn't a nice world. And I supported him. And I went with him to shul, and we met Friday night. And slowly, surely, he became observant without even realizing how it happened. He looked at me, you think I'm religious. But I have a problem. I don't believe in God. Can you help me? And he said, but you know, when I spoke to my Russian doctor, eye doctor, and he asked him, can you help me? And I showed him with this. And he said, think about the eye.
Absolutely. You don't need more than that. But the fact is, every single system in the body works miraculously like that. Think of the eyelid, and there's a tear duct in the eyelid. It carries the tears away from the eye so that the tears don't run down your face, except when you're crying because you're producing a lot. Well, there's a little opening, and it must be situated in exactly the right spot, in exactly the right angle. And if it's not in exactly the right angle, tears will run down the face. Now, if you want to think in terms of evolution, people with that opening to the tear duct, they won't die out because the opening to the tear duct is a little bit different, and yet they don't exist except in an abnormal circumstance. Why? Because the divine engineer put it that way so that it should be comfortable for people. Getting back to the cataract, because that was the question. The lens of the eye, when it's not clear, is called a cataract. So you can have a little cataract that affects vision not at all, or a terrible cataract that affects vision terribly. And then there's everything in between. In my philosophy, the time to operate on a cataract is when the patient wants or needs to see better. In some patients it's earlier, in some patients it's later. It's not appendicitis. It has to do with the patient's needs and desires. But it's a very safe and painless operation. So it's foolish not to do it when you need it, but it's also not necessarily required for a patient who has a technical diagnosis of cataract but has no visual impairment.
I want to thank you, doctor, and wish you and your patients many more miracles, because we believe that the doctor is a messenger of that very healing power that created the body.
Thank
So
you.
you should be the great messenger with a lot of merits.
Thank you. But every one of us is a messenger in some sphere of life to every other one of us.
Thank you so
Thank
much. It
you,
was really
Rabbi.
amazing interview. Thank you so much. It was really very, very inspiring.